Now, when I talk about us being at this moment in history and talk about the data and talk about the infections that can be prevented, we talk about survival and reduction in deaths among people living with HIV as a result of viral suppression, we also have to spend a moment to acknowledge what this really means to the lives of people living with HIV. I think I'm a pretty well-evolved person living with HIV, a pretty privileged person living with HIV, but I have to be honest, I still hold a little bit of that stigma inside of me. I still have that fear that I could have accidentally transmitted HIV to someone that I loved. These new data, hearing Dr. Carl Diefenbach, for example, from the NIH say that someone who is undetectable is not infectious and has a negligible risk of transmitting HIV to a sexual partner, lifts a huge burden off of my shoulders. And in conversations that I've had with a lot of people here at USCA, and from hearing other people like Jeremiah Johnson from TAG, Bruce Richman from PAC talk about these issues, this is real. This is affecting our lives, how we see ourselves, and how the rest of the world sees us. Think about what this means for stigma. If someone who's undetectable cannot transmit HIV, are we a threat? Are we something to be feared? No. We are not dirty, we are not a threat, and we are not disease vectors. In fact, we are the solution. People living with HIV who achieve viral suppression, who become undetectable, are the solution to the end of new HIV infections in the United States. We have to be clear about that power that we have. We have to hold our providers and the healthcare system accountable for delivering the results that our lives depend on. And we have to lift each other up and support those who are facing challenges to achieving viral suppression. We are at a unique moment in history, and I believe that when we look back 20 years from now, we're going to judge ourselves in terms of how well we responded to this opportunity and whether we acted and did the things that were needed to create the systems change and to get rid of the baggage from the earlier years of the epidemic and to really realize that we have the power to end new HIV infections and to end stigma, not only here, but around the world. So thank you.